My name is Chris Carroll.
Hi, I'm Danielle Damon.
I'm Max Barber.
I'm Rachel DeConti.
I'm Josh DeConti.
My name is Farron Day.
My name is Dana Parrott. I'm 22 years old.
I am living with Limb-Girdle Muscular Dystrophy Type 2D.
I have Limb-Girdle Muscular Dystrophy 2D.
I have LGMD2D.
And our 9-year-old son has LGMD2D.
I have a 12-year-old son who has LGMD2D.
I remember that I was diagnosed just about a month after my 7th birthday. It was obviously very soul-crushing and heartbreaking, but I was told, I'm not going to be able to walk eventually.
Trouble running, trouble going up and down stairs, trouble getting off the ground, things like that. I just wasn't moving as quickly as the other kids in my grade. I just remember not being able to jump.
More specifically, I remember kids being able to play dodgeball. It was a little difficult because I wanted to be with my friends and engage with them as well, but I couldn't. I always kind of dreaded it because that's when I had to kind of be reminded that when I was different than most kids.
Hudson's always had kind of like a quiet resolve. As he's gotten older, he's started to notice things more. He has lost his ability to wash his own hair. He can't raise his arms up above his shoulders. And most notably, he can't walk anymore. His whole life has changed in just a few years.
It was one of the scariest, saddest days of our life, learning that our baby boy has this rare progressive muscle disease.
It's always in your mind. It's always in protecting him, protecting his muscles, doing everything we can for the longevity until you can get a treatment is pretty difficult.
Research is urgent because time matters. We need treatments and cures that slow, stop, or even reverse the disease so that kids growing up today don't have to watch their abilities slip away as I did.
We're running out of time. I'm one more year closer to not being able to breathe on my own or not be able to move my arms at all.
If there's a treatment available that stops the progression of this disease and can stop the progression almost before it starts, that is everything to me.
I want to live more of a normal life and have that sort of independence that I was never able to have.
We're very hopeful for the gene therapy, and I've seen how powerful it can be. It's important. We need to continue to push forward.
Finding a cure for Jacob is the only answer. That is the only thing in our mind that should and will happen.
Finding a cure is urgent. He needs something to just stop the progression. Just give him a little longer with the abilities that he has left.
A cure would be so beneficial to all these children that are just being diagnosed. There is so much more that we know now, and we can get the cure to them early. And it's frustrating to see it delayed because it would be so beneficial.
Yeah.
A cure for me would mean everything. It would mean being able to grow up and see my children grow up to be adults. It would be able to live a long and healthy life with my wife, and I would be able to see my grandkids.
A treatment or cure for me would mean peace of mind and independence.
The biggest word that comes to my mind would just be independence.
The most important part is urgency. Time matters.
A cure for me would mean hope.
A cure would mean to us that Jacob can live a more normal life to that of his peers, his friends, his little brother. It would take care of a lot of worry and stress that we face every day. It'd be a blessing. It's what we work hard for. It's what Rachel's dedicated so much of her life to. It would be everything we could hope for and more.